The silent killer. According to the World Health Organization, hypertension or elevated blood pressure is a serious medical condition that significantly increases the risks of heart, brain, kidney and other diseases. An estimated 46% of adults with hypertension are unaware that they have the condition. Less than half of adults, 42% with hypertension, are diagnosed and treated. That's why it's important to understand what high blood pressure is and how you can prevent it. This video will cover the basics of high blood pressure and provide tips on how to reduce your risk of developing this potentially deadly condition. High blood pressure is a dangerous and silent killer. It's often referred to as the silent killer because it can go undetected for years until a medical emergency strikes. Causes of high blood pressure. There are many possible causes of high blood pressure. It can be the result of lifestyle choices, such as eating an unhealthy diet or not getting enough exercise. It can also be the result of a medical condition, such as kidney disease or adrenal gland tumors. No matter the cause, high blood pressure is a serious condition that can lead to heart attacks, strokes, and other health problems. Effects of high blood pressure. High blood pressure is often called the silent killer because it has no symptoms and can cause serious health problems. If left untreated, high blood pressure can lead to heart disease, stroke, kidney disease, and other health problems. The good news is that high blood pressure can be treated and controlled. Hypertension is slightly more common in women and conveys an increased risk of heart failure, threefold, in comparison to men, twofold. Women are more likely to have uncontrolled blood pressure, and recent studies have suggested certain classes of antihypertensive medications may be less effective in women. According to Mayo Clinic, high blood pressure forces the heart to work harder to pump blood to the rest of the body. This causes the lower left heart chamber, left ventricle, to thicken. A thickened left ventricle increases the risk of heart attack, heart failure and sudden cardiac death. How does hypertension cause strokes? Blood vessels damaged by high blood pressure can narrow, rupture or leak. High blood pressure can also cause blood clots to form in the arteries leading to the brain, blocking blood flow and potentially causing a stroke. High blood pressure causes kidney damage. According to the U.S. National Institute of Health, high blood pressure can constrict and narrow the blood vessels, which eventually damages and weakens them throughout the body, including in the kidneys. The narrowing reduces blood flow. When this happens, the kidneys are not able to remove all wastes and extra fluid from your body. Extra fluid in the blood vessels can raise your blood pressure even more, creating a dangerous cycle, and cause more damage leading to kidney failure. Management of high blood pressure. Managing or treating high blood pressure is very crucial because if left untreated, it can lead to a cascade of other serious health problems. There are a number of things you can do to manage high blood pressure. These include making healthy lifestyle choices, such as eating a healthy diet and getting regular exercise. Limiting salt intake. The American Heart Association recommends salt intake of less than 2,300 mg per day, which is about half the teaspoon. Salt intake of less than 5 grams per day for adults helps to reduce blood pressure and risk of cardiovascular disease, stroke and coronary heart attack. The principal benefit of lowering salt intake is a corresponding reduction in high blood pressure. Avoiding tobacco use. The nicotine in cigarettes and other tobacco products makes your blood vessels get narrow and your heart beat faster, which makes your blood pressure get higher. Managing stress. According to Mayo Clinics, there's no proof that stress by itself causes long-term high blood pressure. But reacting to stress in unhealthy ways can raise blood pressure and increase the risk of heart attack and stroke. Monitoring your blood pressure at home or with your doctor. Your health and your diet. Relationship between one's diet and health. When it comes to your health, what you eat is just as important as how much you eat. A healthy diet can help you maintain a healthy weight, get the nutrients your body needs, and avoid diseases. Unhealthy eating habits can lead to obesity, which puts you at risk for a number of chronic health conditions, including heart disease, type 2 diabetes, and certain types of cancer. Eating a healthy diet can help you avoid these diseases. A healthy diet includes plenty of fruits, vegetables, whole grains, and lean proteins. It should be low in saturated fat, trans fat, sodium, and added sugars. You should also limit your intake of alcohol and caffeine. The best way to ensure you're following a healthy diet is to eat a variety of foods from all the food groups. This will help you get the nutrients your body needs. Normal blood pressure is defined as blood pressure as a systolic blood pressure under 120 mm Hg and a diastolic pressure less than 80 mm Hg. Elevated blood pressure occurs when systolic pressure ranges from 120 to 129 mm of mercury with a diastolic pressure less than 80 mm Hg. Stage 1 hypertension is defined as systolic pressure ranges from 130 to 139 mm of mercury or diastolic blood pressure between 80 to 89 mm of mercury. Stage 2 hypertension has a systolic blood pressure greater than 140 mm of mercury or diastolic blood pressure of 90 mm of mercury or higher. Please subscribe for more health videos.